Aurora.
Thank you, Speaker. My question is to the Premier. Speaker, this weekly report prepared for Cabinet provides an ongoing update of incidents involving our air ambulance service. Accounts of pilots not available, paramedics not available, confused dispatch calls. According to the Premier, he doesn't ever recall seeing this report, and so apparently the Minister of Health hasn't thought it important enough to distribute it to her Cabinet colleagues. If the Premier and his Cabinet don't consider this important enough, I would suggest it would be good mandatory reading for every member of the legislature and the public. Will the Premier agree to make this weekly report public so that we can know what's going on at Ornge without having to wait for brown envelopes from frustrated civil servants?
Here.
The Minister of Health.
Speaker, you know, when it comes to who's got credibility on this issue, we have the member from Newmarket Aurora, who is actually calling in to question the credibility of the Chief Coroner of the province. It might be helpful to review the qualifications of the Chief Coroner of Ontario, Dr. Andrew McCallum. He's a graduate of the McMaster University School of Medicine. He served in the Canadian Forces as medical officer and flight surgeon. He trained in emergency medicine at the University of Toronto. He is a fellow of the Royal College of Physicians and Surgeons of Canada. He was a regional supervising coroner for Eastern Ontario, adjunct associate professor of emergency medicine at Queen's University, chief of emergency medicine and chief of staff at Hamilton Health Sciences.
The member from Lanark will withdraw.
I'll withdraw.
Now warned. Minister.
Professor of medicine at McMaster University.
Answer.
Speaker, the member opposite is attacking the credibility and the ability of this Dr. McCallum. I do.
Thank you. Supplementary.
Well, Speaker, I'm not sure which question the Minister is answering, but it's not mine. And I will forgive the Minister because sometimes her notes get mixed up. With every day that passes, Speaker, the Premier, his Minister and his Cabinet are owning the scandal and the mismanagement at Ornge. There's no reason for that. They boast of change, but most of the bodies who created the mess are still there. Rather than make meaningful change, we get meaningless legislation and redrafting of agreements. Speaker, that's why 20 pilots and 11 aircraft engineers have left Ornge since January of this year.
Wow.
They see that nothing of consequence has changed, and they refuse to be part of a dysfunctional organization. The consequences will be an exodus of more good frontline people. When will the Premier admit that his minister is incapable of managing this file?
Be seated, please. Be seated, please. Be seated, please. Minister of Health.
Speaker, it's clear that the member opposite is calling into question the professionals who are responsible for managing our health care system. He is doing this, Speaker, for clearly what are partisan political gain. I think, Speaker, that the people of this province are actually interested in knowing, is Ornge doing what it is that they are supposed to be doing? Just yesterday, Speaker, 49 people were transported by Ornge. 42 patients were transported from one facility to another. 6 by land ambulance, 6 babies, pediatric patients, were transported by Ornge, and there was one incident where a helicopter attended to a scene. Speaker, the frontline staff at Ornge are doing their job despite the ongoing attacks from the member from Newmarket Aurora.
Thank you. Question.